The next MCQ. Manikandan, a 8-year-old boy, has difficulty breathing through his nose. He is brought to his pediatrician. On examination, he was diagnosed with adenoid. So, a young boy with adenoids. So, the type of tonsillar enlargement seen in this patient is. So, it is going to be a pharyngeal tonsil. Okay, adenoid is nothing but enlargement of pharyngeal tonsil. This is a direct MCQ. Adenoid means pharyngeal tonsil. This is a direct MCQ. Okay, so here I added one more MCQ that we already saw. So absolute indication for tonsillectomy and adenoidectomy. This is already in the notes. So that is going to be adenotonsillar hyperplasia with the obstructive sleep apnea, failure to thrive, abnormal dentofacial growth, suspicion of malignant disease, and specifically for tonsillectomy, it is going to be hemorrhagic tonsillitis. So when we studied ENT, the last table, was this. So for tonsillectomy, hemorrhagic tonsillitis is one of the indication. So this point you need to know. Here I'm going to give you one additional MCQ that you need to know. So pharyngeal tonsil, I mentioned it as a PT, please make note. Pharyngeal tonsil. So the MCQ here is, you need to know tonsils are innervated by the branches from maxillary nerve and glossopharyngeal. Tonsils means, you must remember, maxillary and glossopharyngeal. Max GP. Tonsil means max GP. Pharyngeal tonsil means, you must remember, adenoid. Pharyngeal tonsil means, you must remember, adenoid. Tonsil means maxillary nerve and glossopharyngeal nerve. Tonsil max GP. Tonsil max GP. Is that clear? Next important point here is a bleeding tonsil surgery, infected tonsil, or you can say follicular tonsil, antibiotics. So when there is infection, control the infection first, and then you're going to go for surgery. So there's going to be inflammation and also going to be infection. So first control the infection with antibiotics and then take the patient for tonsillectomy, for follicular tonsillitis. So these 4 points you must remember for your MCQ. Is that clear? Then when you suspect a malignancy, in tonsil, then your option is going to be a surgery. So in that case, along with tonsil, you can remove the adenoid also, because a chance of, if you suspect a malignancy, along with surgery, a tonsillectomy, adenoidectomy, performing adenoidectomy is of a good use. So these are the 5 points I want you to remember along with this. I repeat all these points. So pharyngeal tonsil is nothing but enlargement of pharyngeal tonsil is called as adenoid. So PT equals adenoid. That's the first point you're going to remember. Number 2, tonsil means you're going to remember maxillary nerve and glossopharyngeal nerve. Max GP. Tonsil means max GP, you're going to remember. Tonsil means max GP. Bleeding tonsil means you're going to remember, you're going to do a surgery. But whereas a highly infected tonsil, follicular tonsil, means you're not going to touch the patient for surgery initially. You're going to reduce the patient with antibiotics, because follicular tonsil reduces with antibiotics. Okay. Next is, if you suspect a malignancy in tonsil, you're going to go for surgery. Along with the tonsils, you're going to remove the adenoids also for a safety measure. So tonsil plus adenoid, because malignancy means that it's always with a potential to metastasize. So it could either go for the adenoids or it could go for the nearest lymph nodes also. Based on the lymph node involvement, you can, if the lymph node involvement is given in your MCQ, so based on that you can expand your MCQ answer. But for now you need to remember, when you suspect a malignancy, you are not only going to remove the tonsil. That is the point.